So again, as I mentioned, I'm Carrie Klun, and I'm with the Minnesota Department of Health WIC program, and I'm here with Carol Bussman, and we are sharing about the Breastfeeding Friendly Birth Center recognition program that we have at MDH. So we're just going to give you a brief overview of the current breastfeeding rates in Minnesota, share a little bit about the World Health Organization's 10 steps to successful breastfeeding, just for a kind of an overview, talk specifically about what the MDH breastfeeding friendly recognition program looks like, and then share a little bit about how the MBC 10-step learning collaborative can help you along your way of implementing those 10 steps to successful breastfeeding. So one of the reasons that, we really want to encourage birth centers to implement evidence-based, breastfeeding care is that we are looking at, after several decades of improving breastfeeding initiation rates in Minnesota, we're looking at a decline in our most recent data. So when we, in this chart here, we're looking at a comparison of breastfeeding initiation rates from 2017 and then 2021. And so we can see that in, every racial, ethnic, cultural group that we have here, we've had a decline, except for the East African population. We've had a decline in our breastfeeding initiation rates in 2017. So the pandemic, really took a toll on families getting the care they need. And so we really want to, ensure that we're improving our care and helping get us back on track. We also know that in Minnesota, we have had, fairly high initiation rates compared to the rest of the country, but we know that we have really large disparities in our breastfeeding rates across racial, ethnic, cultural groups, and socioeconomic status. So when we look at this graph, we're looking at families that are not receiving WIC services on the left, and then families who are part of the WIC program on the right. And we can see just, just by looking at these initiation numbers that we have a lot of, disparities in our socioeconomic status for breastfeeding initiation. Families, are dealing with a lot of barriers to reaching their lactation goals. And we can see, just how apparent it is that we really need to ensure that we're providing the best support to these families to help alleviate these inequities. And we know that, the pandemic had so many additional stressors for the families that we're supporting, for you as healthcare providers. So many different challenges arose during that time that really, it's not surprising that we are dealing with more challenging breastfeeding initiation rates. And also when we look at our MPINK score, so, the MPINK is that biannual survey conducted by CDC. And if you haven't already completed your survey, they close October 17th. So you still have a little bit of time to complete that. Minnesota used to be fairly high on the ranking for the MPINK score. So we can't compare kind of apples to apples because they did adjust the scoring system. But when we kind of look at those rankings, we were closer to the top in Minnesota, that 13th out of 50. And now we're right in the middle, 25th for the last MPINK survey. So we can see that, we're not really keeping up with meeting those high standards. So some of the areas that have been most challenging are making sure that we have hospital policies that have those necessary elements to support lactation getting off to a good start, clinical competency for our staff in the hospitals, and then supporting rooming in by having newborn care and procedures being done in the family room.
So what are the 10 steps and the WHO code? This is things that many people have heard of. So we just thought we'd go basic with it. The 10 steps was launched in 1991 by the World Health Organization. And with that, the International Code of Marketing of Breast Milk Substitutes. And they've made slight revisions over the years in the code and the steps, but 2018, a significant update was made in the 10 steps from WHO. And then Baby Friendly USA is actually the organization responsible in the US for adopting, accrediting, and with the 10 steps. And then in 2021, they incorporated significant changes that the World Health Organization had made, and there's an update. So what are the 10 steps? Let's see the next slide. I just want to give you a brief overview. The steps have been organized kind of into two groups. The first one looks at hospital policies and the management. So, the policy about making breastfeeding care the standard of practice. It's the normative, but by no means the only option. But also looking at data and keeping track of the support given for breastfeeding. Step 2, and this is one thing that has been talked about, is the staff competency. And the World Health Organization for a long time have asked for 20 hours for nurses at the bedside, evidence-based education. And now they have really looked at that more towards in demonstrating competence in helping mothers, families, birthing parents, with the skills needed in terms of counseling, talking with families, actual hands-on helping with latch, etc., as well as then the providers having 3 hours is a pertinent for their role, so that everyone has the same evidence-based approach to caring for the mothers. So the steps 3 through 10 then are really more clinical. Step 3 looks at the antenatal care that's provided to the birthing parent and looking at the importance of breastfeeding, explaining, offering education. And just last month, the Minnesota Breastfeeding Coalition had a 3-hour webinar on antenatal care. So if you're interested, you could certainly check that out. Step 4 is care right after birth, and this is skin to skin, and we know this is true for all babies, whether they're formula feeding or breastfeeding. This is the best for babies as long as mom and baby are healthy. Step 5, and I'm going to go through these quickly, is supporting mothers to breastfeeding with helping with assistance, providing practical help, support, and then as well as including safe infant formula preparation for families that choose to formula feed. And I think it was just recently the FDA came out with their comments on formula issues that have been in the US. And one of the things that they highlighted is that families who choose to formula feed do not have sufficient information on how to safely prepare formula. Step 6 is to not provide newborns any food or fluids unless it's medically indicated. And if families choose this, then they have a discussion, an informed discussion of why they want this and how this can impact their breastfeeding. Step 7, again, is best for all, is rooming in. Families don't take home a stranger. They've had at least a little chance to learn their newborn characteristics and patterns. And step 8 is recognizing and responding to infant feeding cues, that responsive feeding. And this is for families, whether they are choosing to breastfeed or formula feed. Formula families are shown to hold babies close, good eye contact. Step 9 is counseling mothers about the risk of artificial bottles, nipples, pacifiers. And again, this is one thing that World Health Organization has really not changed their approach, but updated it to have that time of counseling. If this is what a family requests, to listen about why it is they want that, and then helping them make an informed choice. Not guilting, but at least making decisions. But also, if family chooses or wanting to exclusive breastfeeding, how can we help them get to that goal? We know American Academy of Pediatrics says don't start the pacifier till breastfeeding is well established. Step 10 is just that coordination that happens at discharge and referring to community resources. And we know how important that is to, families are in the hospital or the birth centers, and then they go to their communities and they need the support to continue. So that's an overview briefly of the 10 steps.
So the World Health Organization has the 10 steps to successful breastfeeding, and then Baby Friendly USA is the designating body in the United States for giving that recognition. And that can be kind of a daunting recognition to receive. It's costly, it takes a lot of time, and as was mentioned, there are really strict parameters that you need to meet in order to receive that designation. And so the Minnesota Department of Health has a similar designation program, but it's a little more flexible. So it isn't all or nothing. So with Baby Friendly, you have to show that you're meeting all of those 10 steps and all of those specific parameters of each of the 10 steps. Whereas this recognition program allows you to, be recognized for evidence-based care that you are providing, even if your facility might not be able to achieve all of the 10 steps. So for each 2 steps you complete, you can earn 1 star for up to 5-star recognition. It is a self-measured program. So we have a guideline, and you demonstrate through chart reviews and patient interviews how you're meeting those parameters to receive the recognition. It doesn't have any fees associated with it, besides the staffing time for working on those quality improvement updates. And as we mentioned, it's not all or nothing. So you can work on stars at a time and not sequential. So you don't have to work your way through 1 through 10. You can, for instance, say, okay, we're doing really well on step 3, prenatal education. Let's work on getting recognized for that good care that we're doing, and build momentum for working on achieving those evidence-based lactation support. So once again, it isn't aligned with Baby Friendly. It's aligned with Baby Friendly, but it isn't through the Baby Friendly program. It's a standalone recognition. And so we know that implementing these evidence-based 10 steps helps improve breastfeeding initiation and duration for all of our families, and really helps with the challenges of improving our disparities. So it really helps promote health equity. So it's and we encourage all facilities to really look at how can we implement these quality improvement updates and make sure that we're getting families off to a good start.
And so what the 10-step learning collaborative is, it is a group, it's funded by the CDC and goes through the Department of Health, the Minnesota Breastfeeding Coalition. We look at a quality improvement approach. So absolutely, your organizations can look at the Department of Health website and read and go ahead and look at how they can meet these steps. But the collaborative is just a help, and we meet monthly via Zoom as a group, and then usually I meet monthly with the team lead of the organization, looking at what are we doing well. Like a lot of organizations, skin to skin is the norm, or maybe it's been the norm except for cesarean births. And so what can they, how do they measure it? What can they do to show that this is evidence-based care, they're doing well? Rooming in is another one. Discharge planning, a lot of those things are already in place. So it's capturing what you're doing well already. There is $1,000 mini grants available, and I'm just a resource for implementing with any or all of the 10 steps. And it is just meant to be an aid to help organizations actually look at what are we doing with the 10 steps. I know I got an email yesterday, the A1's Perinatal Nurses Week is this week, and one of the top 10 ways nurses are the best perinatal nurses, is they're committed to these 10 steps. So this kind of aligns with what's going on with that. So questions, comments?